Good afternoon, all. Thank you, organizers, for giving me this opportunity. My topic is HER2 and PD-L1 IHC expressions and HER2 genomic alteration and their association and clinical outcome for the advanced bladder cancer. In this slide, we can see the HER2, either mutation, amplification, or other multiple alteration is most common in bladder cancer. So HER2 is an emerging therapeutic target in urothelial cancers. The novel antibody drug conjugates targeting HER2 have shown promising activity in advanced urinary bladder cancer as a monotherapy or in combination with the checkpoint blockage. The ERB2 is frequently altered, ranging between 12 to 30%. The prevalence of HER2 expression in urinary bladder cancer ranged from 7 to 38%. The aim of the study was to define the prevalence of ERB2 alteration in bladder cancer and association with the HER2 expression by the IHC. And the understanding the heterogeneity of HER2 expression and its relationship between the HER2 and the PD-L1 expression. So coming to molecular alteration and genetic testing in bladder cancer, the most common is FGFR3, which is 21%, followed by PIK3, 20%, and followed by the ERB2 HER2, which covers almost 17%. Now, the interesting fact is that the bladder cancer shows heterogeneity in the HER2 expressions. Some cells shows 100% 3 positive, while some shows 1 to 2 positive. This chart shows this inverse relationship between the FGFR3 and the ERB2, and they are mutually exclusive. HER2 expression in bladder cancer by IHC, we can see the HER2 2+ and 3+ covers almost 50% of the cancer. And there is heterogeneity of HER2 expression across the spectrum of HER2 scoring. More the HER2 positivity means if we move towards the 2+ 3 positive, and the chances of getting PD-L1 is lesser. In this patient cohort where the HER2 IHC was 3+, the most patients were male, covering almost 78%, more common in white race, and they were 50% were the active smokers, and the most common site is bladder, and the 75% were the muscle invasive. Coming to the relationship between ERB2 alteration by NGS and HER2 expression by IHC, those cells who showed 3 positive, the chances of having HER2 or ERB2 amplification or mutation were more common. Coming to association between HER2 and PD-L1 expression by IHC, there is inverse relationship between these two. The cells who showed 3 positive, the chances of PD-L1 or by the CPS score was low. By this chart, we can see the outcome of the bladder cancer is lower when they have either ERB2 alteration or mutation is positive. So based on this data, coming studies are anti-HER2 ADC therapies in the development of metastatic or advanced urinary bladder cancer. First one is DDXT and second is disitamab. So this is the Destiny Pen Tumor 02 study, clearly showing the good overall response rate, almost 56% in the bladder cancer. Those showed IHC 3 positive. This is the phase 2 study of disitamab vedotin, showing again the excellent response in the bladder cancers. So coming to the summary, the ERB2 alteration, either mutation or amplification, were identified by the MSK impact in 20% of the urothelial cancers. In our cohort, HER2 2+ or 3+ was present in almost 50% of the tumor. NGS alone may not capture the patient who would potentially benefit from the HER2-directed therapy. So we need to do the IHC as well. HER2 expression heterogeneity by IHC was observed in significant number of tumors. PD-L1 and HER2 expression are inversely correlated in this cohort, and this data support the further investigation of the HER2-directed agents and underscore the need of standardization of the HER2 expression assessment by IHC in patients with advanced urothelial cancer. Thank you.